Communication is an essential form of human behavior, so fundamental to human social systems that our world would be barely recognizable without it. As a fundamental behavior, communication is so pervasive that the profound impact on our ability to engage with our world cannot be underestimated. Hi, I'm Zachary, and today I'm going to be talking about intercommunication in the health environment. Communication competence in nursing means that communication is both effective and appropriate. Effectiveness is achieved when the goals of communication are met. Appropriate means the communication has been adapted to the people and situation involved in the act of communication. Achieving communication competence in nursing is important for optimizing safety and quality in the healthcare and for creating voice and authority needed to advocate for better systems and safer workplaces. Now, let's go and see these words put into action. Here we have the nurse and the doctor communicating to each other about a patient's course and effectiveness of treatment.
Oh, hey, Dr. Drake.
Yeah.
I'm taking care of Bob in room 105.
Okay.
And I don't think he's responding that well to the treatment we've been giving. He still has an elevated blood pressure, and I'm thinking it's due to the pain in his right arm.
Mm-hmm.
And you only have this prescribed for him for the pain, and I was thinking...
Well, you know what, Megan? I'm going to stop you right there. I'm not gonna change his dosage. I know what's best for my patients. I know what his condition is, and he just needs to push through this recovery period, okay?
Okay.
Pause. What we see here is the classic doctor pulling rank over the nurse. Not to say that all doctors operate in these circumstances, but it is very important that all future nurses are equipped with the skills to respond appropriately to uncomfortable situations like this. And likewise, it is important for this nurse to respond appropriately to this doctor. Let's walk through the list of options of how the nurse should respond. Remember, her response should be both effective and appropriate. Should the nurse A, apologize, nod, and agree with the doctor 100%? B, increase her volume to ensure she is heard? C, walk away passive-aggressively knowing the doctor is right? Or D, respectively advocate for her patient with a proper tone? If you selected D, you are correct. By respectively voicing your concern for your patient, you acknowledge the input by the provider, but also advocate effectively and appropriately for your patient using the right tone, the right choice of words, the proper body language, and the giving of your full undivided attention, thereby improving interprofessional collaboration and ultimately improving the treatment of your patient. Remember, intercommunication needs to be effective and appropriate. Let's move on to our next scene. In this scene, we will watch the interaction between the nurse, the doctor, and the patient in the patient's room.
Jamie, your vitals are looking great today. So you're responding really well to the treatment. And do you have any questions at this time?
No.
Okay, good.
Hello, how are you doing, Jamie?
I'm alright.
How are you doing, Nurse Megan?
I'm good, doctor.
That's great. So you suffered from what we call HHNS, which is hyperosmolar hyperglycemic non-ketotic syndrome. This results from the complications of your uncontrolled diabetes mellitus. When you came to us, your plasma BG level was greater than 600, your serum osmolality was greater than 320, bicarb was greater than 15, and your pH was above 7.30. The hyperviscosity in your blood vessels eventually caused alteration in your LOC. From what I've seen from your charts, the treatment has reestablished your tissue perfusion and has restored your electrolyte imbalance using the IV fluids. And from your next lab results, we'll be able to see if we can start you on an insulin treatment. Does that sound all right?
Yep.
All right, cool. Well, we'll get you back and healthy as soon as we can. And both of you have a good day.
Thanks, doctor.
Thank you.
Thank you.
Bye, Dr. Drake. Thank you. Did you get all that, Jamie?
No, not
Yeah, so what he said was you have a lot of sugar in your blood, and your blood became very thick and slow moving, and that's what caused you to become dehydrated. So your blood vessels became ineffective in delivering oxygen to your tissues, including your brain, and that's what caused you to lose consciousness.
Okay.
So we gave you the normal saline to counterbalance the blood thickness and the dehydration, and then we also gave you potassium to help with the electrolyte imbalance. Does that help a little bit?
Yeah, it makes it a lot more clear.
Yeah. He also said when we do your next blood draw, when your potassium improves, that we may start you on some insulin to help with your blood sugar. Okay?
Okay, so you guys are gonna need more blood.
Yeah, we're gonna need more blood, but don't worry, we'll do the best. We'll give you the best care. Okay? Okay. Do you need anything else right now?
Nope, thank you, you've been great.
Okay. Well, I'll be back to check on you in a little bit. Okay?
Okay,
All right. Thanks.
thank you.
What we just saw here was intercommunication between the patient, the doctor, and the nurse. It is important to remember that there needs to be a single language of communication between all parties of the healthcare team, including the patient. Here we saw the nurse in the role of the translator between the two parties, where we saw the nurse taking in the medical intricacies of the doctor and translating it into understandable terms and concepts to the patient. Again, achieving communication competence in nursing is important for optimizing safety, quality, and health care for all individuals involved. It is important that our intercommunication is both effective and appropriate. Let's have a talk with our patient on how she felt today with the conversations that transpired earlier. Hi there, Jamie. How are you doing today?
I'm alright.
Good. Can you tell me a little bit about the conversations with the doctor and the nurse that you had earlier?
Well, so when the doctor was talking to me, I felt like he used so many medical terms and he made it really difficult for me to understand. I couldn't really tell if he was telling me good stuff or bad things. I didn't really know what was going on with me, but ultimately I listened to him because he's my doctor and I didn't want to question him.
Okay. And tell me about your conversation with the nurse.
Well, the nurse made me feel a lot more comfortable and welcome here. I felt like she actually wanted to take care of me and make sure that I understood what was going on and make sure that I was comfortable.
Okay. Would you say you were more anxious, stressed out, or nervous when speaking to the doctor versus the nurse?
I definitely think I was more anxious and nervous when I spoke with the doctor because it was more just him talking to me versus the nurse made it more like a conversation.
Well, that's good. I really appreciate you talking to me, Jamie.
Thank you.
You have a nice day. So we have seen how very crucial intercommunication between all members of a team is, especially in the healthcare environment. One slight deviation or selecting the wrong choice of words or response from effective intercommunication could change the outcomes of a scenario, especially in regards in the patient's health and well-being. Remember, intercommunication must be both effective and appropriate, as well as understandable by all. I hope you have learned effective intercommunication in the health environment and that you have learned to implement your style that is both effective and appropriate in your student and professional careers. Again, my name is Zachary, and I thank you very much for joining us. Have a great and wonderful day.